Last night, I had to call a patient who had a breast biopsy, and her pathology showed that she had breast cancer. She'd had an abnormal mammogram, and her biopsy came back last night, and it did show cancer. So I referred her to a specialist. Today I'm going to talk about referral to a specialist, kind of some of the tips that I talked to my patient about last night, and some of the things that I think you should know. If that sounds good to you, continue watching. Welcome back to my channel. My name is Dr. duPont. I'm a board-certified gynecologic oncologist, and I'm passionate about educating women to lead healthy and productive lives, and I believe that begins with great health. If you're new here, welcome. If you haven't subscribed, please click the link below to be able to get great content when it's uploaded every week. Well, today we're going to talk about referral to a specialist. There's some things that I told my patient that I really think you should know, and I wanted to share that with you today. The first thing that it's important is to know why you're being referred. The patient example I used in the beginning, the patient had a breast biopsy that showed breast cancer, so I was sending her to a breast surgeon, so she knew the reason for the referral. I have had patients over the years that came to my office and they're like, I don't know why I'm here. Dr. So-and-so told me to come and here I am. So sometimes I'll have records and I'll know why they're there. Sometimes I have no records and I'm not sure either why they're there. So if you're being referred, just make sure you know why you're being referred. If the doctor or the nurse calls you, ask, why you're being referred and who you're being referred to. Another thing that's important to know is that doctor in your insurance plan. So I've had some doctors call me and say, hey, can you see this patient? And then, I'm not in their insurance network. So definitely check that beforehand. The office will also try to verify that, but sometimes, insurances have many different subplans. So definitely make sure yourself if the specialist is in your insurance network. Another thing you want to know is if you need a referral, make sure you get that before the appointment. So a lot of times you may need your primary care doctor to send a referral to the specialist office to allow you to get authorization to see that physician so that you're not charged and the doctor gets, paid for that visit. So just make sure that you have any referrals if they're needed before your appointment. The second thing I want you to know is bring your data. So what I mean by that is bring your, pathology, your biopsy, your pap test. If there's anything that's pertinent to your visit and you have the information, make sure you bring it. Sometimes you can get that information off the patient portal. Sometimes, the doctor will give you a copy of the report to take with you to the specialist appointment. Often that information is faxed or sent over to the doctor, but, sometimes, we can't read it or we didn't get it in time or, the doctor's office didn't send it. So definitely if you have a copy, bring it with you because, in my opinion, 2 copies is better than no copies at all. So if you do have information, make sure you bring it. If you have any radiology reports such as ultrasounds, MRIs, CAT scans, if you're able to bring those reports and the CDs if you can, definitely bring those. A lot of times the doctor will want to see the images themselves. Sometimes we can get them from the patient portal or like from an Epic or type of system where we can get the images downloaded to our computers. But if you have the CD and it's available, definitely bring that just in case. Another thing you want to bring is a list of your medications and also a health summary. If you don't have a health summary, I have created one. You can check the link below and to find out how to get that health summary guide. So what I did many years ago is I created one for my mom. She had, lots of different doctors and I noticed she wouldn't always tell them all the information or all her medications. So I actually created a summary for her that she could take to her doctors. And in the beginning, I made sure it was updated. Now she knows how to update it herself and she takes it when she has an appointment. And I also use it for myself. Her doctors loved it. So definitely click below if you want a health summary that you can easily fill in, that you can take to your doctor's office. But whatever you use, a history of your past surgeries, any health issues you've had, any cancer histories in your family or personal cancer histories, those are very important. And then the doctor's office may send you a link to an online system where you have to kind of pre-register or fill out online forms. Definitely do those ahead of time. It's very important that they get that information before your visit so they can look through it. The other thing that I tell patients is to bring another set of ears. And so what I mean by that is to bring a family member or a spouse, a friend, sibling, someone with you that can hear the information as you're hearing it. Because a lot of times, you may be very nervous or scared, or there just may be so much information it's overwhelming. Sometimes if you have someone else there with you to give you support, they may hear things a little differently. So after the visit, you can kind of compare notes and to make sure you didn't miss anything. So I always say bring an extra set of ears. And the other thing that you should also keep in mind is if you have questions, don't be afraid to ask. A lot of times, try to go over the information with patients and try to make sure that they understand it. Some sometimes I'll ask them kind of to teach it back to me, just so that I know that they understood everything I was saying. But if you have someone else with you, if you have a list of questions prepared ahead of time, you'll be able to make sure all your concerns are addressed, because sometimes you just forget because it's just so much information. So definitely keep that in mind. Another thing that I want you to know also is for your visit, keep in mind to arrive early. Try to arrive 15 to 30 minutes ahead of time to allow for traffic, to allow for, being lost. Sometimes if it's a new office you've never been to, maybe a different part of town, you want to get there early just so that you can make sure you're there on time and that you are able to find the area. My office is near a major freeway called I-45, and there is always traffic or an accident any given day. So definitely our patients, we tell them to arrive early because we just never know what they're going to encounter on that particular day. And if you're scheduling your appointment, I advise patients to schedule it early in the morning in the beginning of the day, or the first visit after lunch. Kind of like, when you arrange airplane ticket, you always want to be the first one in the morning, because most of the times we're running on schedule, we're not running behind. Usually later in the day we get kind of behind schedule, and so your appointment may be a little bit delayed. So if you can, try to get that very appointment in the morning, or try to get that appointment the first person after lunch. Those are kind of my favorite times to schedule my appointments, just because I know, human behavior, and I know how things happen. Sometimes you're running behind. I try not to have my patients wait, but sometimes, we just get behind. So try to make those appointments early in the morning if you can, or early after lunch. Another thing to keep in mind is to make sure that you not only arrive early, but keep in mind that you may be asked to sign additional forms. So, I have patients that may be given a link to the patient portal to register, and then when they come to the office, they have additional forms, and they're like, oh, I filled these out already. Well, sometimes there are other forms that maybe weren't in the original paperwork that you may have to fill out. So just keep in mind that you may have additional forms after you arrive for your specialist visit, but don't be upset or angry. It's just sometimes for a new patient, it just takes a lot of information to be able to get everything that we need to know about that patient. And then also I want you to know is that you may need an exam. So when you are referred to a specialist for a consultation, a lot of time that consultation is kind of a getting to know you appointment. We're getting to know about your health history, about the reason why you're coming to the visit, and then also just about yourself. And so that may include an exam. So keep in mind, if the doctor needs to examine you, I liken it to like if you're going to a cardiologist, you would expect that they would listen to your heart. So if you're going to see a GYN doctor or a GYN oncologist, keep in mind they're more likely going to need to do a pelvic exams to be able to examine those areas of concern. I've had patients over the years that say, oh, I'm bleeding, I can't come. A lot of times the blood doesn't bother me because, as GYN doctors, we're used to vaginal bleeding. So a lot of times I actually want them to come and not recancel or not reschedule their appointment or cancel it, because the bleeding, it does not get in my way. We're able to wipe it up, and it doesn't bother us. A lot of patients are self-conscious and they're worried about it, but we do this every day, all day, and so we've got great systems in place to handle bleeding. So definitely don't cancel your appointment because your cycle started. Just let the nurse know some of your concerns, and I'm sure they'll be able to see you that day. But definitely be prepared for an exam. I've had some patients say, oh, I didn't expect an exam today. Well, if you're going to see a cardiologist, expect them to listen to your heart. If you're going to see a GYN doctor, expect them to want to do a pelvic exam. The other thing I want you to know is that everything may not be done on that first consultation visit. A lot of times we may have 30 minutes or 60 minutes to do your visit, and so we may not be able to do additional biopsies, or we may not be able to do, like a colposcopy if you need that. So just keep in mind you may have to come back for a second visit, usually in a couple of weeks, to be able to finish the evaluation of your medical issue. Okay, so just keep in mind and be patient with the team with that. The other thing is that your specialist copay visit may be higher than your regular doctor's office visit. So just keep in mind, usually the doctor's office will let you know ahead of time if you have a copay, but it's also usually printed on your insurance card. So just keep that in mind if you do have a copay, that the specialist copay may be a little bit higher than what you're used to paying. Well, I hope that's helpful. I do have another video on preparing for your doctor's visit, and so if this information was helpful for you, please watch that video next. Thank you for watching to the very end, and I hope you enjoyed this video. Please give me a thumbs up if this video was helpful for you, and if you have any experiences you want to share that may help others, please put them in the comments below. And until next time, have a great day. Bye-bye.